So greetings, I am Mentors. We're very fortunate today to be able to talk with Dr. Cicely White. She is a member of the University of Washington School of Medicine faculty and participates in the foundations level teaching as well as in the admissions process. In addition, she's our service line chief for pediatrics and is a member of the KP Washington Equity, Inclusion, and Diversity Advisory Board. So thank you, Dr. White, for being with us today. So we're going to go through a series of questions to just learn some more about the process of applying to medical school, especially for some of us who maybe haven't applied in a number of years. So my first question is, looking at sort of the AAMC website, I noticed there's a focus now, a development of the core competencies. I was wondering if you could just talk about that and how medical schools use them in the application process.
Great, thank you. So first of all, the AAMC is the Association of American Colleges, and it's essentially the guiding body for medical schools and residency programs in the United States. And they define their core competencies in 4 ways. The top 2 are interpersonal, which kind of composes your social skills, your ability to communicate with others, work on a team collaboratively, what's your understanding of cultural diversity, and just some basic sense of resilience. And then you have your intrapersonal skills, which kind of come down to, what are your ethical decision-making principles? How reliable are you? How dependable are you? What level of consistency have you demonstrated over time in other things that you've been part of? And then, of course, also required for medical school are things like medical reasoning skills, critical thought processes, and just kind of a general scientific prowess or interest in demonstrating kind of consistency in those skills. So ideally, those are kind of the 4 competencies that most medical schools are looking for in medical students when they apply.
And so do they look at, I guess, the spectrum of what the student has done in terms of the application to see if they, like how strong they are in the various competencies?
Right. And most applications have multiple layers of processes, right? Generally starting out with some automated process that involves, evaluation of, your overall GPA, perhaps an MCAT score, and then just kind of looking at how you have indicated responses that relate to those core competencies within the application. Some medical schools will then also kind of look at, is this an in-state resident versus out-of-state resident? And that might, again, kind of help filter their process. And then at some point, it goes from being automated to being reviewed by an actual person. And again, that individual is then again looking for, examples that represent those 4 competencies, and primarily looking for, is there a consistent timeline of demonstrating that behavior and interest and passion for medicine.
Great, thank you. And I guess just moving into some more specifics about the application in terms of extracurricular activities, when some of the students are trying to balance studying with perhaps working or other things, like how should they think about which extracurricular activities to target and how deep a dive into those activities?
Again, because being a physician is a lifelong career, we want to make sure that when someone makes that decision to join this career field, that ideally they are as positive as they can be that this is what they want to do for the rest of their lives. It's a huge commitment just from the standpoint of academics, the amount of time, the financial investment into becoming a physician. So to get into that career field and then determine that it is not at all what you expected or not as desirable as you thought it might be, I think would be a huge disservice for anyone. So in the process of looking at those extracurricular activities, while they don't all have to be directly related to medicine, we do want to make sure that they demonstrate that someone has kind of taken the time to perhaps explore, the career fields and have a true understanding of what it means to provide service to others first and foremost. And so, again, looking for some consistency in, community involvement or commitment to other individuals, some sense of selflessness, because that is going to be required to be a physician, right? Your patients come first. And so you're kind of, as an interviewer, as an a person that reviews applications, you're looking for different activities that demonstrate that. Again, they don't always have to be directly related to medicine, right? So that can be, activities through your church, it can be activities through school, it can be volunteerism, through a particular organization that you're a part of. But then within those roles, are you just a member, or have you demonstrated the ability to be a leader? Can you demonstrate examples where you've, maybe been in a leadership role, but you also know when it's appropriate to kind of step back and follow and encourage others and be a mentor, at the same time. So, those are some of the things that we're looking for. It's not so much the experience itself, but more what are the qualities in that experience and how have they impacted you as an individual? What have you learned from it, and how has it demonstrated professional growth for you? Because that's what we really want to see at the end of the day.
Thank you. That's a really helpful insight. I mean, I guess similarly with, clinical exposure and experiences, I guess what are some that you've seen on applications? How, do they look for anything specific in the admission process?
I do think it's important to have some clinical exposure for sure, right? Like, so I talked about extracurricular activities can be a little more broad and varied, but it is important that you spend time, actually in a clinic or in a hospital, to demonstrate and show some understanding of what it's like to be part of a medical team, or to observe, closely, how a medical team functions. It's also helpful, I think as a person interested in healthcare, to know what it's like to really be responsible for someone else's care, to experience, the emotions that patients, go through, happy or sad. So that's where I think kind of spending some time in a hospital setting, in a clinical setting, in a nursing home setting, something that kind of gives you that, bird's eye view upfront and close and personal of, what it's like to be in that medical setting is truly important as part of your experiences in preparing to apply.
Good, thank you. And then we had briefly mentioned about GPA and the MCAT. I guess how are those looked at, like in terms of any, like, do some schools have cutoffs, or is it more of a holistic approach when you're looking at the whole application?
Yeah, I'm happy to say I think most medical schools are going toward more of a holistic approach. That being said, clearly, being in medical school, being a member of the healthcare field, it's a rigorous academic road, and you do have to demonstrate that you have the ability to get through medical school, right? Again, we don't want individuals to get to medical school, accrue, this huge amount of debt, and then not be able to graduate and eventually progress to attaining that medical degree, which is how they're going to have the financial means to pay back, any loans or debt that they've accumulated from school. So while a GPA may not be specifically set by a particular school, clearly it is something that can be important. I think how important a GPA is, or even an MCAT score is, will vary from one school to another. And it's important to kind of research different schools and kind of see what their priorities are. Most medical schools, when you do your research of their sites, will tell you what at least the average GPA is for applicants that they accept, as well as an MCAT score. Some schools will have a specific cutoff for their application process, and that will be clearly indicated on their website. Sometimes that cutoff is a true cutoff. Other times you may have the opportunity to appeal that, but that is generally something that you have to request individually and talk to someone specifically within admissions for that process to occur. But it is important to know that medical school academically is difficult, and you want to be prepared. there are opportunities and programs that are available for individuals who may have had maybe a tougher time in undergraduate school, or perhaps, took time off between undergraduate school and then kind of went back to graduate school, and, were able to demonstrate higher or better academic progress at that time. But because they look at the overall GPA, maybe your overall GPA is still relatively low, and there are opportunities to explain that and talk about that when you do your application process. So I would never be discouraged by a school website that says you need this GPA or the average GPA is this or that. But I think it is definitely important to know that med school is rigorous. It requires a huge commitment, and academically you do want to be prepared, and you want to make sure that you've set yourself up to be successful.
Yeah. Well, and I imagine, like you mentioned, there are ways to let various admission committees know in your application, like if you sort of worked on like your study skills, like you would see maybe different growth, right, in terms of their GPA in later years versus earlier, or if they did like a post-baccalaureate program or something like that, if you see differences kind of in their ability to study and maintain a certain GPA sort of later on, or if they had to integrate, different habits because of life circumstances or anything. That I think it's a great thing that you pointed out, that there's probably ways to, in your application, maybe convey that to the admissions committee.
Absolutely. And it's important to be able to do that. One thing about going through this process is that it may, involve being vulnerable at times and disclosing information about yourself that you may not necessarily want others to know. But the good thing is the application process is confidential, and members outside of the admissions committee don't see that information. If you do get accepted to medical school, your colleagues will never know that information. But it is important if you have, a lower GPA or a lower MCAT score, and you feel like you have circumstances that explain why, despite those maybe less desirable marks, you feel like you're a good applicant, then you need to disclose that information and, pour your heart out as to, why you feel like you would still be a good student in medical school.
Good, thank you. And I guess sort of in relation to that, I think one area that the mentors will be very helpful and probably get asked for help a lot is in writing a personal statement. And so like if they, from the spectrum of like where to get started to also giving feedback in terms of the personal statement, what would you sort of advise our mentor group in that regard?
Sure. So your personal statement is your opportunity to basically show who you are as an individual, as far as why you are a great applicant, why you would be a great member of the class, why you will someday be an outstanding physician. At the same time, you also have to, you want to define yourself in a way that makes you stand out, right? So this is your kind of opportunity to use different experiences that you've had to, describe the impact of, any shadow experience, patient interactions that you've had, and why it has solidified, right, your thoughts, your ideas, your passion for why you want to become a physician. I would say that your personal statement is not necessarily the place to explain your lower MCAT score or your lower GPA. There will be another section on your application process to explain that or put that. Your personal statement is the place for you to shine. So you want to, again, using your own words, using your own personal experiences, try to convey to someone in writing what it is about you that's going to make you a great physician, that's going to make you a great classmate, that's going to make you a great member of a medical team, and what it is about you as a physician that's going to make you take great care of patients. And ideally, that's your goal in writing your personal statement. I would say oftentimes what we tend to do is we underestimate our personal experiences and how they have influenced us. And sometimes it can be difficult to put those things into writing. And so as a mentor, I feel like the biggest thing that you can do to help your students is really try to help them understand how to highlight some of those experiences that they, in their minds, may seem, very normal or perhaps minimal, um, and turn them into, I guess, outstanding individuals when they write it down.
Yeah, I love what you brought up earlier too, in terms of activities, that it's not just talking about doing an activity itself, but what you sort of got from the experience,
Mhm.
and how it sort of shaped you. And it seems like this would be like a great place to bring up those points.
Absolutely, absolutely. I think your personal statement should definitely be about showing growth over time, and again, how just that decision of becoming a physician, evolved, right? And not just kind of that initial, well, I've wanted to be a doctor since I was, in kindergarten, but the true reality of how did that vision form in your mind, and what experiences you've gone through that have really solidified that for you.
Yeah. And you mentioned this a little bit, the idea, trying to make your application stand out, the like how, what, beside, I guess the personal statement is one area to do this a lot, but how do you sort of capture that, admissions committee person if you get to the in-person review, so that they put you in the pile that, they want to look back at again? Or there's sort of ways, especially with, I guess, the descriptions of things throughout your application and framing things that sort of make students stand out more?
Yeah, I would say definitely descriptions of things. Try to spend some time, even if it's not long periods of time, but unique opportunities that may have come your way. And maybe that might be some job that you did, perhaps that may have not even had anything to do with medicine, but something about that experience really, again, influenced you in a way that either created a sense of motivation, or some kind of just life changing or life turning moment that happened to you that really kind of advanced your path. I mean, those are the types of things that people want to know, and want to hear about. They want to see, where does your passion come from, where does your passion lie, because this is their first glimpse of trying to understand, if you are going to be a physician one day, what kind of physician are you going to be, and how are you going to be able to influence others around you. What does that look like? And so essentially, in your personal statement, you're trying to demonstrate that you have the ability to do that.
And I guess along the lines of where they see themselves later, how important is it to like express, either what type of doctor they want to do, or if they, see a balance of clinical and research? Are those important things um, to highlight, or like what if the student maybe doesn't know yet?
Yeah, I think declaring a specialty is probably the least important, right? Again, unless you have very unique experiences that have influenced your decision to become a physician, and that's why you want to be now this specific type of physician, right? And if so, then again, highlight those, describe those, right? But if your desire to be a physician is coming more from just, I I recognize that I have resilience. I want to help others. I have a passion for medicine and changing healthcare, and wanting to make it better for others. You can do that in almost any specialty, right? And so you don't have to know necessarily what type of specialty you want to do. And I would say, don't make up one, don't create one if you're not sure. It is absolutely okay to go into medical school and not be sure, what type of physician you want to be. But again, there's a certain passion that comes with just wanting to be part of that healthcare team, and being a leader of a healthcare team, which
Mhm.
often a physician is. And so again, those are the experiences that you're wanting to highlight.
Great, thank you. I think another area that the mentors will get asked for assistance is in the interview process, sort of preparing for them, maybe even practicing. I guess, what advice would you have in that regard for the mentor group?
Yes, any individual should go through a mock interview process, and whether that's a structured mock interview program, which again, lots of medical students, that's part of some of what they do to kind of give back to their community. Oftentimes, if you again go to a medical school site, especially the student sites, there's information there about how you can perhaps contact students that are already at that medical school and talk to them about what their experiences are like. And then even if you don't see anything that talks about, the students doing mock interviews, I would ask them if they have a program like that, because most medical schools do. And that's one of the primary things that those medical students do to help other students who are interested in coming to medical school, in a way of giving back. And because they've recently gone through that process, they're probably the most knowledgeable, and some of the best people to work with as far as, becoming prepared for an interview, or what types of questions are asked.
Mm.
If you don't have, again, a medical school that's near you, or the opportunity to do that with someone, then again, just practice interviewing with anyone. But absolutely, your first time being interviewed should not be in front of the admissions committee, right? You want to have done this 2 or 3 times with someone else. We all have lots of thoughts in our heads, and we think we know the answers to, what we want to say, or the words that we want to use. And then very quickly you realize that once you start to talk, sometimes the words are hard to come to you, or it's hard to put in words, exactly what you're feeling, or exactly what you're trying to describe. So you want opportunities to practice that. You want people to hear, how you describe it, how you say it, be able to give you feedback on, again, if you're underestimating an experience, they may be able to give you kind of some examples of how you can describe it at a much higher level, so that, again, you are truly given the credit, and people are hearing the best of you, and not just kind of this subpar version. So.
Thank you. And then for students who maybe don't get in the first round, what advice, if the mentor is like counseling them on it, about reapplying or anything like that?
Yeah, first and foremost, do not be discouraged. Again, about 40 to 45% of individuals, that apply to medical school the first time will not get in. Not because you're not qualified, not because you're not ready, not because you're not going to be a great physician, but because there are just not enough spaces, available for all of the people that are interested. And so, again, don't be discouraged. Don't assume that you did something wrong. Don't assume that, you're not ready. Most medical schools will have some process where you can actually receive feedback after you've gone through an application process or an interview. And I would say, look for that, seek that, ask the admissions committee directly. Is there anything, that you would recommend that I can improve on my application? Were there any comments or feedback that you can provide me from my interview? Just reach out and ask. And if you go to the website and you don't see, again, a specific, place to call, then, there's always going to be a contact for someone in admissions, and just email that person. Most of, the administrative staff and the admissions, and you may not be able to talk directly with someone on the admissions committee, because sometimes those individuals are protected, but certainly the administrative staff who are not directly involved in interviewing can sometimes provide feedback to you. So I would say ask for that. And oftentimes, again, the case is not so much that, you aren't ready, or it just wasn't your year. So don't be discouraged. Definitely apply again. Some schools do have, a limit as far as how many times you can apply. And I would say that, again, if there is some work that needs to be done, do that work before you apply again. If you do receive feedback from someone in admission with regards to how your application can be better, or, some changes in your interview, make sure you do those things that were recommended, and make sure that those things are then reflected when you apply again, either through your application or through that interview process.
Thank you. That's great advice. And then for students who either through their, it's pre-planned, or because maybe they didn't get in the first time, if they do have a gap year, what tends to be some good ways for them to maximize their application during that year?
Yeah, sure. And again, gap years are not bad. They're not negatively looked at by admissions committees by any means. I think sometimes you're going to have admission members who actually prefer students that have had a gap year, just so that they, again, have opportunity to do more exploration and can, show some maturity in their decision making. But that being said, when you have a gap year or you have kind of time from one application cycle to another, I would say use that time wisely. It's okay to work. It's okay to be employed. we recognize that at this point people are usually now out of undergraduate school. You have a responsibility to pay, start paying back loans if you've had student loans, which most of us do. So get a job. That job does not necessarily have to be in the healthcare field, although if it can be, do so. Lots of individuals will do things like become a medical scribe just because it enhances their shadowing experience, and it's something that they can do, and get paid at the same time. But again, the job doesn't have to be in the medical field. If it's not in the medical field, make sure you do, though, maintain some connection, some volunteer experience. You continue to do some shadowing because, again, being a physician is about longevity, right? And what you don't want is to come off as someone who's kind of been hit or miss as far as your commitment to being part of this career or this career process. And so again, we do look for consistency and experiences over time. And again, that consistency doesn't mean that we're looking for you to do something every week, but if you have kind of a 2-year or 3-year gap between graduating from college and then applying to med school, we just want to see that during that time frame there is some consistency, either by way of research or shadowing or volunteering, again, to that commitment to wanting to come back to this career.
Thank you. And then just to kind of wrap up and end, is there any other advice that you would have for our mentor group as they help students on this journey?
Right. Just be encouraging. Again, this process can wear you down. It's a lot to go through, I think, mentally for the individuals that are involved. Again, you can be the best of the best of the best, and on any given day still not get in. And that can be hugely, just hugely discouraging. And so I think as a mentor, what we have to do is we have to remind them, what, this is not necessarily because, you're not good material or you're not ready or you haven't done everything that you have to do, but we have to encourage them not to give up. Sometimes also, I think we have to encourage our mentees to do something outside of their box, right? It's really easy to do things that are comfortable, to be in places that are familiar. But sometimes what you may need is a unique experience to, again, really make you stand out and really separate you from the rest of the pack. And so encourage, individuals to do something unique, to be willing to, do something different, to show that they can thrive and be resilient amidst, being uncomfortable. That says a lot to an admissions committee. So I think that's another important point. And again, not just doing that experience, but being able to grow in that experience and then articulate it and articulate what they gained from it.
Well, thank you so much for all the advice and information that you provided to our mentor group today. And thanks for being with us and being part of this effort.
You are welcome. It was a pleasure.